I'm Rusi Shroff, hosting an all-new season on your very own MMTSL View. During this season, we will bring you various doctors and wellness coaches to help you with your complete well-being of mind, body, and soul. MMTSL is a one-stop solution for all your medical and wellness needs. It provides an A to Z to A hassle-free service to all medical value travelers. Today, obesity-related diseases are amongst the top 3 killers across the globe. Long believed to be a problem exclusive to high-income countries, over 70% of the world's 2 billion overweight individuals live in low or middle-income countries. Faced with increasing disability, mortality, healthcare costs, and lower productivity, obesity is a growing concern for all countries. It's time for global action. Thus, this brings us to the topic for today, obesity. Time to act now. To cover this important topic, it gives me much pleasure to announce that we have an expert on the panel today, Dr. Aparna Bhaskar, a renowned bariatric and an advanced laparoscopic surgeon with an experience of 12 years. She was the first surgeons in India to be accredited by the Surgical Review Corporation as a Center for Excellence Surgeon. Special interest in single incision surgery and has one of the largest series of single incision bariatric surgeries in India. She has done more than 15,000 surgeries till date. A warm welcome to you, Dr. Aparna Bhaskar. We would love to hear your thoughts on obesity. Time for global action.
Thank you so much, Mr. Shroff, for having me here today, and very thankful for the kind introduction. So I'm going to be speaking about obesity, and I'm extremely passionate about the topic and the disease both. Obesity, as we all know, is defined as accumulation of fat in the body to such an extent that it starts producing health-related problems. And obesity is a disease that affects the human body from head to toe. Today, the world is facing an equal pandemic of obesity and related diseases. And as we all know, that obesity is very, very closely related to type 2 diabetes. And unfortunately, obesity affects not only the affluent countries, but in fact, what we have seen now, that it affects the poorer countries much more than it affects the affluent countries. Unfortunately, the problem is that the poorer countries do not have the healthcare resources to be able to tackle a problem such as this. When we talk about obesity, obesity actually is at the root cause of many other diseases. It affects the human body from head to toe. The 3 main diseases which are related with obesity are type 2 diabetes, high blood pressure, and high cholesterol levels, or dyslipidemia. Together, these 3 form, along with obesity, something that we call as metabolic syndrome. And metabolic syndrome is a condition that ultimately will lead to an increased risk for heart disease, or as we call it, increased cardiovascular risk in a person. So to say it in a layman's language, basically we start with obesity, it leads to metabolic syndrome, and which ultimately leads to an increased cardiovascular risk, ultimately leading to shortening of the lifespan of a person. And this is extremely important to understand. There are many other diseases which are associated with obesity. In fact, today it is very, very relevant. Just this morning, there was the headlines in Times of India on front page today that a person who's suffering from obesity is actually much more prone to even developing COVID-19 infection. People who are suffering from obesity have higher chances of hospitalization due to this pandemic. They also have a much higher risk of getting into ICU if they are suffering from obesity. So this usually basically happens because obesity has a negative effect on your lung health. So what happens is that there is a condition called obstructive sleep apnea, which affects the health. There is also restriction of space. So lung space gets restricted because of the abdominal fat which is accumulated. So your lungs actually do not get enough space to inflate and deflate, and that is what leads to increased carbon dioxide retention and less oxygenation inside your body. So this basically leads to a lot of issues related to lung related problems. And hence, this also increases our propensity to any kind of infections which are basically targeting the lung. And COVID 19 today is, of course, one of the major ones. Obesity also has a very major effect on liver health, which is very, very important. Till very recently, alcoholism was one of the biggest causes for cirrhosis of liver. And unfortunately, now obesity has replaced alcoholism as one of the most common causes for cirrhosis of liver. So, being associated with one of the biggest transplant hospitals in the country, what I see today is that a lot of patients who come for liver transplants actually have developed cirrhosis, which is secondary to obesity and not really because of alcoholism. So obesity actually leads to something called as fatty liver. Now, all of us, when we go for routine health checks and we do ultrasounds and we get our reports, fatty liver is a very, very inconspicuous finding. Most of the times when we visit our doctors, we are given advice that, oh, it's nothing. And, you just need to lose a little bit of weight and it will settle down. But I think we really need to take a note about fatty liver, because ultimately, if left untreated, fatty liver leads to something called as non-alcoholic steatohepatitis. And if that is not checked in time, it can lead to cirrhosis of liver in some cases. If the main treatment for this liver problem is again related to weight, and weight loss really works beautifully even for patients with fatty liver. Now, obesity also has a lot of other side effects, especially weight related side effects like on your joints. So, we get a lot of patients who've actually been to orthopedic surgeons because they start experiencing severe back pain, they start experiencing severe knee joint pains, and it's mainly related to weight bearing. Human body is designed to, or the joints basically are designed for bearing a certain amount of weight. And in today we are seeing that patients, sometimes we see patients who are almost double their body weight or even sometimes triple of their body weight. So the joints actually start giving away. And a lot of them actually are advised to undergo joint replacement surgery as well. Now, gout is something else which is related with obesity. And we see a lot of times that uric acid levels are very high in patients who are suffering from obesity. Then women and obesity is a very special relationship, because women actually are much more prone to developing obesity, probably because of the hormonal makeup. Plus, women also have a much lower lean body mass as compared to men, and hence we've seen that the rates of obesity in women is almost double as compared to men, uh, even in India. So today in India, we have almost 20 to 22% of women who are suffering from being overweight or obese, as compared to about 8 to 10% of the men. So when we talk about women's health and obesity, there are many factors that need to be taken care of. It starts at a very young age, and today we see that a lot of our young girls develop something called as PCOD. So that is polycystic ovarian disease, or the polycystic ovarian syndrome, which is called as PCOS. Almost every third girl today is said to be suffering from PCOS. And PCOS and weight gain is a vicious cycle. So PCOS leads to weight gain, and weight gain in turn leads to more PCOS. So it is a cycle that is very, very difficult to break. And there is a lot of stigma attached to PCOS, because the usual advice that our young girls get from all their relatives and parents and friends is that, oh, I mean, you're lazy and you're not doing anything, and that is why you're not able to lose weight. But we really need to look at PCOS very, very seriously, because this is one condition which, despite a lot of effort, does not allow a person to lose weight. So that is about PCOS. Uh, as the woman grows in age, PCOS can ultimately lead to infertility in a person. And we have seen that a lot of women who suffer from obesity also struggle with infertility. And even treatment with artificial reproductive techniques, the results are poorer in women who are suffering from obesity as compared to normal weight women. Even if they conceive, The pregnancy is also not very smooth. We see a much higher rate of miscarriage in women who are suffering from obesity, much higher rate of cesarean sections in these women. And also, when the baby is born, the baby has a much higher chance of developing obesity and type 2 diabetes in the future. So, these are problems which are related to obesity. Obesity and cancer, again, is very, very closely related. So, obesity is related with many kinds of cancer. In women, especially uterine cancer, which is mainly endometrial cancer, and breast cancer. So these are very hormone dependent cancers. We need to understand that the body fat basically makes us is a very big organ, which also leads to increased estrogen production. So whenever there is increased estrogen production, the estrogen dependent tumors will have a higher chance to develop. So breast cancer and endometrial cancer is seen very commonly in women who are suffering from obesity. In men, we've seen that pancreatic cancer, colonic cancer, and many other kind of cancers actually are commonly associated with patients who are suffering from obesity. So this is basically a broad spectrum of all the diseases that are associated with obesity. Now, the other aspect which I would like to talk about is the mental aspect. So there is a lot of stigma and bias which is attached with obesity. And patients who suffer from obesity actually are perceived by the society in a very negative manner. And everybody thinks of them as people who have less willpower, or they have very less self restraint. We always think of them as people who are basically eating too much and not really, taking care of themselves. We think of them as lazy. We think of them as people who are not capable. We think that they are ugly. So there are many perceptions about people who are suffering from obesity, which may not really be true. And but yes, they do add to a lot of body image issues amongst patients suffering from obesity, and may lead to low self-esteem in these patients. So this is another aspect that must be paid attention to. Coming on to treatment options. Now, whenever we talk about weight management, there are, like every other disease, in obesity also we have grades of the disease. So when we talk about somebody who is overweight, we talk in terms of body mass index, because that is the easiest way to define obesity, and it's easy to remember, easy to classify. So if a person in India falls between a BMI of 23.5 to 27.5, then we consider that person in the overweight category. If the person has a BMI between 27.5 to 32.5, then we call them as somebody who is suffering from grade 1 obesity. And 32.5 to 37.5 is grade 2 obesity. 37.5 and above is considered to be grade 3 obesity. So just like any other disease, say like cancer or lung disease or liver disease, our treatment strategies need to escalate as per the increasing grade of the disease, right? Now, along with this grades of the disease, we also have associated diseases. So somebody may be grade 3, but may not have any other associated disease like diabetes or heart disease or hypertension. But a person who is suffering from grade 2 may also be diabetic, or may have high blood pressure, or may have any other associated disease, which is basically because of obesity. So then again, the severity of the disease changes, and we have grading systems according to which we will grade the person. When we talk about treatment options, if diet and lifestyle modification is at the baseline, and it is a part of all therapies for weight loss. So whether we are considering only diet and weight loss therapy, we could be considering drug therapy, we could be considering endoscopic management, or we could be considering bariatric surgery. Diet and lifestyle modification remains a part of all these modalities. When a person is overweight, or say he's progressing to grade 1 obesity, diet and lifestyle modification works beautifully. Such patients should be consulting a qualified dietitian or a nutritionist and taking a medically supervised diet. Please do not go on to the internet and do self dieting. Just take a diet from the Google and just start on something, because diets again are something which are based on a lot of scientific matter, and they should always be done under supervision, because ultimately anything that you do can also lead to harm. So once you are consulting somebody who's qualified, they will be able to give you right advice about what kind of diet will be suitable for your body type. So if you are overweight, which is basically about say 5 to 7 kgs overweight as compared to your ideal body weight, then I think you must consult a dietitian and get onto a good diet plan, a good exercise plan, and you should be able to get down to your normal body weight. Now, a person who is in grade 1, if they do not have any other associated diseases, again, diet and lifestyle modification forms a beautiful therapy for such people, and it will be easy for them to get the weight down. But we also come across certain patients who have tried to lose weight many times, but they have not succeeded. Or they might have succeeded, but they may have ended up regaining that weight, because ultimately it is not easy to be on a diet forever, because our body's feedback mechanisms are such that when we start depriving ourselves for very long, the body starts craving for more food. So if a person is waxing and waning between weight loss and weight gain, and they have started to develop other associated diseases like, say, diabetes or high blood pressure, then maybe they might need an escalation in therapy, and you might need to see a dietitian along with an endocrinologist who will be able to advise you about what would be the best route to take. So maybe you need certain kind of weight loss medications which may help you to lose the weight and keep it off. At the moment, when we talk about weight loss medications, in India, we do not have too many medications which can be used for weight loss. So we have something called as orlistat, which is basically which acts on the basis of fat malabsorption. Now, the diet that Indians eat is mainly carbohydrate rich. It's not really high on fat as much. And hence, this drug actually doesn't really work much for us. Even otherwise, we have a couple of other drugs. There are some anti-diabetic medications and GLP-1 analogs which can be used for weight loss. But then there is a limitation to these medications as well. But yes, they do form a good tool to help patients lose weight, especially if they have been regaining a lot of weight. Now, when we come to grade 2 and grade 3 obesity, in grade 3, bariatric surgery would be the treatment of choice, because here diet and lifestyle alone will not really work and will not be effective for this patient, and will not give them good results. Unfortunately, what happens is that most patients are subjected to these therapies because people are scared of surgery and they have a lot of fear when it comes to any kind of surgery or operation. So they feel that, oh, let me try this diet, let me try that diet. But you need to remember that any kind of diet or exercise regime will ultimately lead to a weight loss of 8 to 10 kgs, and not more than that. And most of these therapies cannot be sustained for more than 3 to 6 months. Ultimately, when you will stop the program, you will not only regain the weight back, but you might also gain a little bit more than what you had lost in that program. So when we talk about losing, say, 30 to 35 kgs or more than that, we see patients who are 120 kilos, 130, 140, 150 kgs and above. So when it comes to that kind of weight loss, then bariatric surgery is the only effective option that can lead to weight loss, which can be sustained for a much longer period of time. When I talk about bariatric surgery, it is basically a laparoscopic surgery. By laparoscopy, I mean minimal access surgery, wherein it is not like the olden days where we would make a big cut on the tummy. But here, what we do is that we would make about 4 to 5 tiny little cuts, which are about half to 1 centimeter in size. And the entire surgery is done through this. You put in a camera, and we see this the internal picture on a screen and operate through that. So that is how most gastrointestinal surgeries are being performed today, and that includes bariatric surgery. This is very, very advantageous for the patients, because uh, this is much lesser trauma to the patient. Hence, the pain levels are very reduced. Our patients after surgery can get up within 4 to 6 hours and can start walking, which is very important for us. We would want them to walk around as soon as the surgery is over, within 4 to 6 hours. And most of the patients actually go home within 48 hours after surgery. So the discharge process has been expedited mainly because the surgery is now laparoscopic, and they can also return to work within a week to 10 days. So this actually was not really possible when we were performing more of open surgeries. Laparoscopic surgery also has much lesser chances of wound infection or hernia formation and things like that. So these are the advantages of laparoscopic surgery over open surgery. Coming to procedures in bariatric surgery, there are mainly 5 procedures which have been approved by the Obesity and Metabolic Surgery Society of India. And these include, sorry, 1 minute. These procedures include gastric banding, sleeve gastrectomy, Roux-en-Y gastric bypass, one anastomosis gastric bypass, and a duodenal switch. Now, out of these 5, gastric banding is a procedure which is completely outdated now. I remember that about 14, 15 years ago, when I had just got into practice, gastric banding was a very commonly performed procedure. But gradually it went out of favor because the results were not very good, and it didn't really agree with Indian diet, because again the Indian diet is very carbohydrate rich, and our patients did not experience very good weight loss. Also, the band was a silicone prosthesis which we would place inside the abdomen, and that had complications of its own. So it could erode, it could slip, so many things could happen. So gradually, over the last 10 years, I think the number of bands being performed has gone down drastically. In fact, I think today it is even difficult to find a gastric band in the country, and it's not only in India, it's all across the world that the number of gastric banding surgeries has gone down drastically. Now, the other surgery, which is duodenal switch, again, is a very, very malabsorptive surgeries, and it leads a very high protein requirement. So for our patients in India, our protein intake is not very high. A lot of our patients actually are vegetarians. So this is a surgery which most of them do not sustain. So we are mainly left with 3 procedures. One is a sleeve gastrectomy, one is a Roux-en-Y gastric bypass, and a one anastomosis gastric bypass. All these procedures have very good weight loss results, and most of them would lead to about 60 to 70% of excess weight loss. Weight loss after bariatric surgery is something which takes about a year or so. So it's not something which is immediate, and there is no immediate transformation that happens. So we get this question a lot of times during our consults that, doctor, when I come out of the operation theater, how will I look? So the answer is that you will look the same. But if somebody sees you after 6 months to 8 months, they will just walk past you and they will not be able to recognize you. So the weight loss happens in about 12 to 16 months, 12 to 18 months, and the person starts losing weight gradually. And most of these, a lot of this weight loss actually happens very fast in the beginning. So in the first 3 to 6 months, most patients would lose about 50% of their excess weight. And the remaining weight takes about another, say, another 6 to 12 months. Along with weight loss, what we also see is that all the other associated diseases, so like diabetes, high blood pressure, high cholesterol, joint pains, gout, infertility, PCOS, all of these show very significant improvement, even obstructive sleep apnea, fatty liver. In fact, we've also seen that NASH, which is non-alcoholic steatohepatitis, it completely reverses after weight loss happens. So if a person, many a times we see that people come when they are on 10 or 15 medications, and post bariatric surgery, within 6 months, they become much more healthy, and the number of medications that they have been taking for associated diseases comes down drastically. So it leads to not only weight loss, but also improvement in diabetes and all the other associated diseases of obesity. Patients who are on CPAP actually stop using the CPAP for sleep apnea within 1 or 2 months after surgery. So in that sense, it is actually almost miraculous. Now, a lot of people are scared of surgery. They feel that, oh my God, the surgery may kill us, or we will die during surgery. So there are a lot of myths around this surgery. um, we must always remember that negatives about anything are always highlighted much more than the positives. So the surgery has actually changed and transformed many lives. And the risk versus benefit ratio, if you ask me, the benefits are too many and the risk is quite less. The complication rate of bariatric surgery is as low as 1%, and it is actually the same as, say, a gallbladder surgery or a knee replacement surgery or any other surgery that a person will go through. So, whenever you go through any surgery, there will be a certain risk of complication. No doctor or no health professional would ever be able to give you a 100% guarantee. But I think we need to go ahead with a positive mindset, because the benefits that the surgery will actually give you is are totally worth taking a small risk in terms of complications or any side effects. Side effects, I wouldn't really call side effects. I would say that there is a lot of care which is required post surgery. So this care is mainly related to, a lot of it is related to diet and nutrition. And hence, whenever you're visiting a bariatric team, you must always see that there is a team of good dietitians who is around to support you, because the surgeons will ultimately get busy with surgery and you will mainly need support which is related to diet and supplementation. And support is needed after bariatric surgery for life. So it is very important to have lifelong follow up with whichever team you are getting operated with, because we need to monitor your weight and we need to monitor your uh, blood tests and deficiencies, etc., for a long time. In fact, this goes on for life. So there is a once a year health checkup which is required after bariatric surgery forever. And I think that is more or less about it. And the other question which most people have is about weight regain. So a lot of people are worried that if we do surgery, then would we regain the weight back? Now, what we need to understand is that bariatric surgery is a chronic obesity is a chronic progressive disease, and just like heart disease. So if you suppose today you need an angioplasty and there is a stent in your heart, tomorrow there may, if you do not take care, if you continue with your old habits and do not change your lifestyle, do not modify your lifestyle, there may be a situation where you may need another stent in your heart, or it may not really be related to you or your anything that you are doing. It's just how the disease is. It is progressive and it increases in intensity over a period of time. So same is true of obesity. More severe the disease, more we need to put in efforts. So surgery will do about 50% of the job, but 50% of the job has to be done by lifestyle modification after the surgery. So it is very important to follow a healthy diet. It is extremely important to exercise a little bit. We do not ask you to do too much. You don't have to do anything hi-fi, but at least 30 to 40 minutes every day for 5 days a week is something that is required after bariatric surgery, and that is required for life. So surgery is no shortcut to weight loss. It is helping you. It is a tool which is basically leading to massive weight loss, which would not be possible otherwise. But to maintain that, some degree of effort is needed. Even otherwise, if the weight still increases despite putting in efforts, that is where the importance of follow up comes in, where you really need to be in touch with your primary team. And if you feel that your weight is going up by 4 kilos or 5 kilos, you should immediately get in touch with your bariatric team, who will provide you with solutions for what needs to be done at that point and to get the weight back. So, if regular follow up is happening, of course, everything can be kept in check and treat it like any other disease. Once you get diabetes, you are with your doctor or with your diabetologist for life. Similarly, if you're suffering from obesity, you will always be with your bariatric team for life or with your nutritionist for life. So it is not a one time thing, it is a lifelong thing. So, with this, I think I would like to come to an end to my talk. And I think I have tried to cover as much as possible. Of course, this is a very vast topic and there is a lot of detail which actually needs to be covered, but maybe we can have another session sometime soon. So, thank you so much. Thanks a lot for having me here.
On behalf of MMTSL, thank you very much, Dr. Aparna, for sharing your very insightful experiences and helping our audiences with the way to deal with the obesity epidemic. With this, I would like to conclude the session and say that there is no simple solution to the obesity epidemic. We all need to make better choices. So let's make the right choice in our dietary habits, in our schools, in our childcare settings, at work, and in our community. Thank you everyone for watching the video. Please don't forget to like and share the video. Also, please subscribe to our channel and stay updated with all our upcoming latest videos. Thank you once again from MMTSL. Goodbye.